There it goes. There they all are. Right here in front of me may be the solution for your pain that you're having that no one else can figure out or fix. So let's get into it and see. I'm Dr. John Clayton, your Layton chiropractor here in Utah at Supra Chiropractic. We want to help you get out of pain, and this is one of the tools that I use to help people get out of pain on a daily basis. And it's more effective than anything else I've seen, especially when I pair it with adjustments. So let's get into it. So the whole point of this video is to go into detail and depth, showcase what it is that I do when it comes to dry needling, how it helps with adjusting patients, and why it's so effective, and why you see so many videos on my channel, at least, as to why I do dry needling for patients. And I do it throughout the entire body, basically. And it's because it is so effective. So hope you guys enjoy. Without further ado, let's get into this video where we show the adjusting, dry needling, and then at the very end, we'll go through a recap as to quickly why we did these areas on this patient and how it's going to help them moving forward. So I hope you guys enjoy. Perfect. Sorry, it's a smaller room too with all the different angles and cameras and stuff. So real quick, do you feel like when we talked about that shift, kind of side to side, do you feel like you have that at all, like in your pelvis, when it spazzes out on you?
I haven't really had any spasms.
Okay.
That's the thing. It's just pain.
Okay.
So if I come this way, it does feel real tight right here.
Okay.
This side's not so bad.
Okay.
Maybe a little bit, but not too bad.
Okay. Okay. And you don't feel like your core is like off at all?
I mean, I don't know.
Okay. Yeah, because like when I look, like, and we could probably use even, it's kind of hard with the mirror there, but if I look straight at you here, it looks like you curve that way, like you're kind of at a diagonal that way. So it's kind of like this almost is what it looks like to me. So that's usually that spasm of those muscles in the spine. So we'll definitely hit those really good.
Okay.
And I'll make sure too when I push on those areas, it's like, hey, it's right there. So it's probably usually L4 or L5 is your most common ones, but we'll make sure we isolate it so we really cook those ones good. Okay. Okay. So, okay, perfect. So we're gonna run through everything. Is that okay with you?
Yeah.
Okay. Deep breath in here, all the way out. Let it go. Deep breath in here. Let it all the way out. Deep breath in here. Deep breath in here. Deep breath in here, all the way out. Deep breath in here, all the way out. Deep breath in here. Deep breath in here, all the way out. Deep breath in here, all the way out. So there's L5 right there, super, super low. And then L4. Okay. Is that kind of where you're having the pain, or is it higher?
No, that's about right where it's at.
Right where it's at, okay.
Try a little bit higher just to make sure.
Yeah, L3 is right there.
No, it's not as bad.
Okay, L2.
No.
Okay. L1.
No.
Not too bad. Okay. It's always surprising when people have L1 or L2. It's like, what? That's not common. So, yeah, usually it's like, let's just go with the most common ones here. So, L5 and L4. Yeah, they just kind of feel kind of pinched together. So, it's all good. Okay. A little bit of rotation there. So, see how I push on this side here versus this side there? I can push in really easy there. Okay. This side here, it's like, stops me, right? So that's a really good sound effect, right? Okay, here and then here. See how it's different there, though?
Yeah.
It's almost like they're kind of twisting opposite ways from each other. So, That might give you that unstable back feeling, I guess, right?
Yeah.
So let's rotate L5 back first. Just gonna get right in there. Deep breath in. All the way out, let it go. Not too bad?
No.
Okay. Right in there. Deep breath in. Okay. I'll twist you in just a second, get the rest of those ones. So I'm going to run through the rest of your spine here. Deep breath in. All the way out. Deep breath in here. All the way out. Let it go. Good. Deep breath in here. There they all are.
Yeah.
Deep breath in here. Deep breath in here. All the way out. Okay, so now into your neck, shoulder area up here. Deep breath in here. All the way out. Let it go. Deep breath in here. All the way out. Let it go. Solid. How's the arms doing?
Better.
Doing better?
Yeah.
Okay. Okay, perfect.
It hurt for a couple days after.
Oh, yeah. I kind of beat you up last time, sorry.
Yeah.
What was the worst part? Scraping?
You know, probably, because I think it, you know, the nerve kind of felt like it was on fire.
Yeah.
After that.
Hey, at least it felt more awake.
Yeah, oh yeah,
right?
for sure.
You're like, thanks but no thanks. My nerve hurt after that. And it
did.
wasn't feeling as good after.
It did after a couple days, so.
Gotcha. Okay, that's usually how it goes. Most people are like, I hate you until they feel some relief after 24 to 48 hours. So, okay, deep breath in here. All the way out. Let it go, let it go. Let it go all the way over. Do the fun side. Over there, let it go. Not too bad. Okay. Bend that guy up here. Right there. Perfect. So let's get you over just a smidge. There. Okay. Is your shoulder hitting there? Are you okay? There you go. Okay, so now you go here. So I'm going to have you bring, actually, let's do it a little bit different here. So you're going to bring this arm across here. You're going to hold there. Okay, so I'm going to sneak underneath here. Okay. Then we're going to get right on to L5 and then L4. Okay, so we got to pull L4 this way and L5 the other way. Okay, so we're going to get right in here. Scoot this cheek toward me just a bit. There you go. Okay. Okay, and then you're going to headlock my arm, try and break my arm basically. Get in there nice and tight. So just got to find that point where L4 opens up right there. Okay, breathe in, breathe out. Okay, pull my arm super tight, super tight, super tight. Let it go. Okay, slipping out there. Okay, I'm gonna get in there a little bit deeper now. Okay, so I'm gonna go right in here. Relax there. Okay, deep breath in. Try to keep pushing your leg off. Holy cow. Okay, now I'm gonna do this hip here. Tuck that guy there. Deep breath in. All the way out. Okay. And lay in your other side. It is a little bit tight in there, I'd say. Okay. See, I've got to do kind of the same process in a way. Scooch toward me a little bit. Okay, so we're going to bring arm down. Hold there. Hold on there. And we're going to go underneath here. Get nice and low here. Okay, lock me in tight, tight, tight. Okay. Lock it in tight, 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 tight. There it goes. Beauty. I need that one right now too. I feel like my back's super tight. Okay, breathe in, breathe out. And lay your back for me. Did it hurt at all when you pulled your legs last time?
No.
Okay. Let go there. Okay, let this relax here. here. Not too bad. Check arms here. So we can get a little bit more release out of this one here. That go there. Always tight. Cubital tunnel, baby. Let's grind that one out next time.
Okay.
So, did you buy any of those tools though?
No.
No.
The tens.
Yeah, feel how tight that muscle is right there.
Yeah.
Okay. Too been putting the tens on it though?
Yeah.
Okay, perfect. Just been spazzing out like crazy.
Yeah.
So, yeah, the good thing is, like, I've even had people where it's like, hey, bring one of those tools to work with you, right? And that way you can just do it right. Like, even if you're wearing this, like, jacket or whatever, you can just go right over the clothing and just kind of breeze it real quick, right? Just like that, and work up there, okay? Then if you go all the way open, yeah, see it's like a little awkward, right?
Yeah.
And then you get that pronator teres right there.
Oh, yeah.
See how gritty that is? Okay. Yeah, because in the end, it's like, I always tell people, if you can go through and work on this, daily, just have a tool at work and just, hit it real quick, it'll speed up the process. And that way, when I intervene and go in there with like needles or whatever, it's less intense because you're already used to pain with scraping it. So,
Yeah.
okay. Let's check this arm here. Let that relax here. You go all the way in towards the side. Let it go. There's some good movement there. Take that all day. Look at that. Look at that. All right. Check this right here. Go all the way over, let it go. Let it go. Not too bad. Let that go. Here's a tight one. Jeez Louise. Let it go. A little click there. Any issue with your neck being adjusted at all?
No.
Okay. Relax it down. See? Let it go. Here. Where's that? Let it drop in here. There we go. Not going to force it. So, deep breath in here. All the way out. Okay. Anything else for you?
No. Okay. Pretty good.
Ready for the needles? Ready or not? All right.
I mean, sure.
Yeah. Let's do it. Yeah. Okay. Go ahead and sit up here for me. Let me get these cameras off real quick. So what we're going to be doing here is doing some dry needling on our patient. And so we want to first kind of assess what we're going to be working into. So we've got some lower back pain, so we're going to be focusing primarily on the lumbar multifidi muscles, which are going to be the spinal stabilizer muscles that basically are the closest thing to your discs and spine. And so they also, when they have an issue, will mimic a painful disc radiation type issue, and basically gives you the same signs and symptoms that you would see, but it's negative on an MRI. So what we want to do is find the SI joints, which are going to be these two hip bones right here. Basically right in the center of that is going to be the L5. So we want to go here and find the L5 spinous process. So we want to make sure we're not on the sacrum, which will be right here. We want to be on the L5 right here. And so we're just going to go right there on the spinous process, just to the side of the spinous process. You're going to see this needle here. It is a 60 millimeter needle. We want to just go right into that area here. Feel a little muscle spasm in there?
Yep.
Yep. I know it's funny, a lot of people are, you didn't show the muscle spasm. I can't show it. It's the patient that has to feel that. So, okay. And then we're going to do the same thing on the other side of L5. So we did our spinous process right here in the center. Just going to go just to the side of that here. Okay. So how did those feel?
Not too bad.
Not too bad. Feel more than last time a little bit, but not too bad.
Yeah.
Mainly probably because it's muscle spasm, I'd say.
Yeah.
Right? Okay. Yeah, you can't ignore that one, sorry. So, okay, so we're going to go through. Now we're going to do L4. So we're basically going to be, usually it's about inch to inch and a half above. L4 is going to be right there. Okay? So we find L4. We're just going to go to the side of L4. Right there. There we go. A little bit tight skin there. That's okay. Okay, there's our L4. So now we're going to go to L4 on the left side. Just like that. And I'd say L4 probably didn't feel as bad as L5, correct?
No, it didn't. So
then that way we can use this as a tool too, and we say, okay, if the patient feels more pain or aggravation at L5, then most of our problem is going to be kind of in that area. And I would say arguably between L4 and L5, L5 to S1 is going to be our most common area for lower back pain within the spinal region there. So then what we're going to do is go through and needle the glutes now, so you can see what it looks like when it's all put together and all the needles are firing together. And that's the cool part, is that I can run up to 12 needles when I work with patients on one machine. And so most times you go to someone that does dry needling, they can only run 2, 4, maybe 6 needles at a time. But we want to run as many as possible when it comes to a problem that's going to basically have all these constituents that make up the problem. If I release all of them together, I get better results and I can get the patient better faster. That's the goal. So we're going to show you what it looks like when they're all hooked up and they're all firing together in just a sec. All right, so we have the dry needling in, machine's already hooked up, and we're going to do the L4, we have the L5, and we have the kind of gluteus medius minimus area as well as gluteus maximus down there. So we're targeting all these areas to help relieve lower back pain for these patients. This is also super effective for sciatica in patients as well, whether it is sciatica that just came out of nowhere or someone has chronic sciatica as well as these ones, especially in the spine right there. You can see these ones are targeting chronic low back pain for a lot of people that have their back just go out all of them and then it gets better, then it goes out again, and then it gets better. That's usually an issue with muscles deep in the spine. So we're fixing those multifidi muscles and getting them to relax. so that we get rid of the pain for the patient. All right, so just to recap on this video for this patient, we have noticed that when patients come in with lower back pain, there's a few things that can go wrong, whether it's their back just kind of tweaked out of place and it's just the muscles that are reacting, or their bone actually kind of popped out of place, so to speak, where the person actually felt like something go and click and pop, and that usually means that the bone has popped out, not fully out of place, right? But it's popped out enough to cause them discomfort. We have to then adjust that and fix that so that they can actually be out of pain. So that in and of itself, as far as adjusting properly, being able to diagnose, assess what's going on, and just fix the issue right then and there, that is the number one thing that we have to do. And that's why you see me adjust these patients before I do the dry needling, because we have to have the foundation or the bones in place or the joints in place, right, to actually do the muscle work, because the muscles, tendons, ligaments, all the soft tissue has to then set around the foundation, which is going to be the bone structure. And so if you don't have the bones in place, the analogy that I give patients is that if you build a house and the foundation is not level, and then you have to build your house on a foundation that's like this, you can still do it, but is the house going to last as long as a house that's on a level foundation? No chance. So you have to have the foundation put in place first, and that's why I suggest that patients pair the adjustment with the dry needling so that we get the overall encompassing basically result for the musculoskeletal system, and in turn that affects the nervous system as well, because we get the pressure off of the nerves, we get the muscles to relax so they don't pinch the nerves as well, and that way we have the really good result of pain-free patients. And honestly, we get that in one visit. So that is the goal. That's why we do these things. That's why I show what I do. I have nothing to hide. What you see is what you get, and that's what patients get here at Supra Chiropractic. And in a lot of ways, that's what people need nowadays, is just that quick fix that takes an hour or whatever, 45 minutes, whatever this appointment is, right? To get in there, fix the issue, because the 2 to 3 minute adjustment just isn't cutting it at other chiropractors. And so I like to show what I do. I like to be different. I like to show the things that actually work. And like I said, it's like I want to show people the success of what we're doing so that hopefully more chiropractors do it, or more practitioners out there will do things like this, even if it's physical therapists, right? A lot of them are taking on things as far as manipulations and dry needling as well. But usually chiropractors, the whole chiropractic adjustment is saved for chiropractors to perform, but physical therapists do a version of that called manipulation. And they have full right to do that as doctors of physical therapy. So in the end, if you have questions about these processes, what I do, anything that doesn't make sense to you, leave it in the comments below. Make sure you subscribe to this channel so we can make more videos for you, or if you want things shown to help educate you on what it is that I do and some of the different things that I actually work on compared to most chiropractors. So in the end, I hope you guys enjoy these videos. Be sure to check out all the other videos. And if you are in Utah and you are someone that has pain, or you need to come to Utah because you have something that I can work on or help with that no one else in your area does, then hit me up. Feel free to message me, call my office, and we can get you the help you need and have you come out to Utah if you need to as well. So in the end, I'm going to leave you like I leave you in every other video. We're at Supra Chiropractic. We've got your back and everything else, and we'll see you in the next video.